Hello and welcome to another edition of Sarah Game Media Live on YouTube and Facebook, and welcome to the special edition today, which is World Cancer Day. Well, I want to apologize first of all before we go any further for say sorry for the late start, and I believe say the health show is why we're here tonight, and the health show is always prompt. Even Sarah Game Media is always prompt. So I know say all the fans of the health show partnership program are waiting for this particular program for today's show, and it is none other than World Cancer Day. And with me in the house, I've got two of Sierra Leone's finest. And these two of Sierra Leone's finest are the most prolific young ladies that are working very hard within our community. And they've done so much work within the cancer reach. And I feel say most of what they don't do has been beneficial to cancer patients and people who are going through cancer and people who have family members that are going through cancer, both in Sierra Leone and in the diaspora. And today I have none other than Mrs. Aissatou Cissé and Mrs. Nimata Conte Toure. But today we're going to start with Aissatou Cissé and let her just introduce herself. She doesn't need an introduction, but I think she wants to introduce herself. Over to you, Aissatou, and welcome to your health show, which is being hosted by myself today within the Sarah J Media House. It's not a lamp, but it's the health show. So welcome.
Thank you, T-Boy, and thank you. Good evening, viewers, or hello to wherever you are. Thank you for your patience and understanding. I know we were meant to start at 8 o'clock, but due to technicalities and, of course, the fact that we're all working people, we've had to rush around to make it to time. So please accept our apologies. Who am I? Me now, my sister. Ona darling, Aissatou Cissé, CEO of the Health Show, and I know it's been a very, very long time, but I'm so in awe with the excitement that has come today when I posted the flyer and where we late the amount of messages I've had. So I'm really, really impressed and happy that you're always welcoming and eager to see what information we want to share. So Aissatou is a cancer specialist and palliative care specialist nurse by background. I'll leave the rest for later, but we're here today because it's World Cancer Day, and we want for just bounce ideas, knowledge, experience, get you, the viewers, very, very engaged. We want this to be interactive. We not just want for can talk atuna. We want we all get a conversation, have a discussion about World Cancer Day. And so I'll take it back to you, T-Boy.
Thank you very much, Aissatou Cissé. I know your introduction is brief, short, and swift, to the point.
Yeah.
And the easy way if you say you go to the points, you know how for bore you with all your qualifications, your laurels, your certificates, your awards. If we continue for saying award and everything else we don't achieve over the past 10 years or 15, 20 years since being a cancer specialist, it go flop this soup. But anyway, let's do that. Another fine young lady, we also don't work alongside Aissatou for quite a long time, and I believe saying himself now one of the specialists in cancer. Welcome, Mrs. Nimata Conte Toure. Welcome to World Cancer Day and welcome to the Health Show, your show, and I'm in charge today.
Thank you, Sarah Jem, for hosting us today. I really appreciate you. And as T-Boy don't say, one of the quiet one, but very vibrant at the background. So I go by the name of Nima, Mrs. Toure. I'm a cancer nurse specialist, and I've been in the cancer field for over 18 years. And my background is head and neck cancer, and supporting people through cancer journey has been the most rewarding thing I've ever done in my life, because it can be challenging, but holding somebody's hand when they're going through challenges is the most thing that any nurse will stand out there and say, I feel proud because I've made someone feel better. So today is World Cancer Day. We're here today to interact with you, share our knowledge, get your questions going, and we hope to make this evening a successful one. Thank you.
All right, thank you very much. I can call you Auntie Nima, and I know we'll stop for calling you Auntie Nima. I'm reason best known to myself. So today we are here for the specific purpose of World Cancer Day, and I believe everybody really within our community possibly don't come across a cancer patient in their life one way or the other, either a family member or friend or somebody. We just know somebody, we know somebody. And within our community, we've suffered great loss with cancer. And I feel we don't take it now very serious. Before, it was a taboo not to talk about cancer. And we realize, the more we shy away from the more it becomes difficult and challenging for the people who go through and the one they the carers and supporters with the patient then. So, Ice, why do you think today has been a significant day for celebrate as World Cancer Day?
Well, I think over the past 20 years, I'll say, it's really been thought of in terms of how we go make more noise about cancer and how we will galvanize people and how we will raise awareness and how we will promote cancer in general. And I think that is why National World or International World Cancer Day was born, really, which is the 4th of February. So today really, it's about reflecting. It's about making the biggest noise, and it's about introducing the campaign, the World International campaign, as to where do we see ourselves in the next 3 years, or within our goals, then within our ambition, within our vision for cancer and those suffering from cancer. So that is why today is very important. And as much as I haven't done this program for a while, I thought, no, today will not go amiss. It was very important to mark today. And as you said earlier on, we've lost a lot of people in our community, both here in the UK, but also in Sierra Leone and the rest of the world. So I think it's important we continue to make some noise about it.
It's good that we're making the noise. And I think some of the noises that you guys have made over the past couple of years has been significant and much beneficial to the civilian community, both in the diaspora and back home. So there's a specific theme for this particular World Cancer Day, which is United by Unique.
Yes.
Can you give us a brief about that?
Well, up until 2024, which was last year, the theme was Close the Care Gap, which was around, the themes are always around inequality in healthcare and provision of health and so on. But this time, this one, United by Unique, it's really about understanding that together we can make a bigger impact, but notwithstanding that is not forgetting that everybody's cancer story is unique to them. Everybody's experience is unique to them. How they feel is unique to them. But if you bring all those uniqueness together and unite them, you get a stronger voice and you make a bigger impact. So that's why.
Wow. So United by Unique. I mean, the significance of the word United is bringing everything together. So basically all the different forms of cancer patients that we've had over the past couple of years within our community has made a great difference in how they relate to each other. Because you guys have brought together a huge community that we possibly don't think does exist over the past couple of years. Nima, how do you feel in terms of bringing in that sort of characteristics behind what we have gone through as a community and the cancer patient that you've gone through, you've seen them, you've gone through some of the stress and tribulation that they themselves have experienced. And for this particular theme is United by Unique. How do you relate all those various different forms of cancer in terms of this particular celebration?
Having said that, T-Boy, United by Unique, every cancer is unique in its presentation, and every individual is unique in their own right. So the medication that will be good for you will not be good for me. Hence, we're doing this. because one thing I've learned over the years, Afro-Caribbean people, we're always presenting late.
Yeah, you have to say it properly, you African man, then, because
Yes.
we say Afro-Caribbean.
So I would say Afro-Caribbean people because this include the global majority mainly.
Okay.
Because we are the majority, but we always suffer inequalities in health. And sometimes most of us present to see our doctors when things are worst. That's why we're doing this. That's the aim of this theme this year, to make sure we raise so much awareness that early intervention or early detection save life. So we really want to come out here and tell people to recognize the early signs and symptoms of cancers so that when it's caught early, you have a chance of survival.
Okay, you mentioned early intervention is very crucial as the stages that people always go to the hospital when it's too late. What are some of the symptoms people should be looking out for in terms of the various different forms of cancers that we have within our community?
So I will not shy away from talking about my own specialty because from a head and neck background. So first of all, if I tell you signs to look for, if you have any change in color in your oral mucosa, like if you see white patches, red patches, those are things that in your mouth, you shouldn't sit down, get yourself checked. That's why it's important to attend our 6-monthly dental checkup, because these are things that will be picked up because we are not looking into our mouth all the time.
So you can get those signs from your mouth?
Yes.
Wow.
So some of these things might be dysplasia, but if it's caught early, we can prevent them to turn into cancer. So that's one. And for example, now I'm working with orbital cancers of the eyes. So every lump that presents in your eye that's been there for more than 6 months, that's not going away, please go and get it checked. Some other signs that you will look at, which is general for most cancers, that weight loss, unintended weight loss, persistent sweating, like I know with menopause you
I was
sweat.
just about to say that.
But if you're not going through the menopause, even if you're going through it and it's getting too bad that you're soaking the bed really wet at night, please go and see your GP. Anemia are some other signs of, I know most of the time we talk about solid tumors, but there are blood cancers as well. So they have different symptoms that present. So anemia can be one of them, high temperature, fevers, persistent infection that is not going away, like all the time, every 6 months you're getting infection. Please go to your GP and get yourself checked.
Wow, thank you very much, Nima, for that. I think what Nima have just said is an eye-opener, and I think every individual watching this program should make sure that they look out for some of these symptoms just in case. Just in case, we're not predicting anything, but it's good to check yourself up all the time. Some of us have a bad habit. We don't do that all the time, not regularly. I know they're looking at me now like, yeah, you have to be doing it too. But again, on a very serious note, these are some of the things we take for granted within our community. Our community is not that too familiar with going to the hospitals on a regular basis to do their medical checkups. But I think if you have the opportunity and you live in the diaspora, it's always there, you should grab it. And if you don't grab it, I think you're making a big mistake. So I'm pleading to some of us, the men and the women who are out there watching, continue to do your regular check because it helps a lot. So let me go to Madam Aishata Sise Jalo. I know you've been on this for quite some time and it's been challenging for yourself as an individual and some of the things that you've gone through. So moving away from the normal basis of what we see as cancer, what are some of the challenges that you guys have faced within our community to actually broadcast and talk about the symptoms, the illnesses, the early stages, the middle stages, and the late stages? I know you're a palliative specialist, but what are some of the concerns that you think you might have?
Well, for me, I think you initially said challenges. I think our community is unique, but not unique. So, and I don't want this to come across as we're being negative about our community, because there's various communities. And as Nima said earlier on, it's all about us Africans and the Caribbean. We all have to pay attention to our health. And some of the challenges we're faced with in our community is that people don't want to talk about cancer. They don't want to hear about it. There's that level of fear. There's that level of anxiety. There's that level of the unknown that makes people just want to shy away from it. So those are some of the challenges. And also sometimes there's that level of really lack of encouragement for us as healthcare professionals, where people think, what are you doing? Why are you doing this? Mind your own business, that kind of thing, which can be challenging. But for us, we do not relent, because talking about cancer, educating people about cancer, promoting health and well-being is our passion, is our vocation. It's a vocation for us. Us sitting here, it's a vocation. Because as Nima said earlier on, it is not easy. It is mind-blowing. It is physically, it is mentally, it is emotionally draining and quite demanding. So in order to do it and sustain it for the number of years that we've done it, I mean, between the two of us, we've done it for a good 30 odd years. So you need that level of tenacity. You need that level of resilience. You need that level of ability to be resilient and don't lose focus in terms of what you want to do and what your objective is and your goal. So I would say those are the challenges, but they're not challenges, and we're moving the goalpost. We're moving the goalpost in the right direction. When the health show started 7 years ago now, nobody in our community wanted to talk about cancer.
Sure.
Nobody, even just mentioning the name cancer was kind of a big thing. Now, over the years, people who are being diagnosed are coming out publicly, or they're sharing it with their loved ones. Okay, yes, we've had lots of people who've died of it, but the biggest difference is, prior to 7 years ago, we literally will hear somebody has got cancer, the next minute they're dead. Now, at least we hear about it, we know about it. And so, as Nima said earlier on, our focus for our community is to really emphasize the need of early detection.
Okay.
And looking out for those symptoms and having those conversations if you're not sure or you're in doubt. So I think.
So what has brought the change, this significant change, compared to what it was like 7 years ago, for people to actually discuss it, talk about it between their family members and friends, and even yourself?
Well, for me, cancer is my bread and butter. I've worked with cancer since the year 2000. So it's 25 years now going. And it's a very complex disease. And of course, you've got over 200 types of cancer. But when you pay attention to it, it's quite interesting to learn about it. And it's quite rewarding, but also quite, it's intriguing, because as medical science moves and evolves, so does the treatment. But at the same time, so does the cancer cells themselves evolve.
So they're making it difficult at time change.
Yes, and react and respond to this treatment.
Okay.
So the best aspect of it is early detection. Early detection, especially if we're talking about the diaspora, our community here. Of course, it's different from Sierra Leone, and I know probably we'll come to talk about that later. But here, for us, it's really about how quickly people take notice of the changes that they're experiencing in their body, or what they see that is not the usual, and how quickly they get that seen to, I think is very important. And why we keep talking about it is because we're seeing a lot of people dying, you know. I always refer to those deaths as premature death, in the sense, maybe, just maybe, if they'd caught the cancer sooner, they might still be with us, or they could have had longer in terms of prognosis and so on. So, yeah.
So within our community, I know it's been a challenge for people to come out, but like you said, 7 years ago, compared to the way it is right now, people are becoming very comfortable to discuss it. There are myths that people possibly think is the reality. Sometimes people say it's lifestyle or it is hereditary, where it means it goes through family by family. So what are the differences from the lifestyle and the genetics?
Well, genetics-wise, we all have the oncogene. It's called the oncogene, and we all have it as human beings. Everybody has it. The difference is, for the majority of people, it remains dormant, which basically means it sleeps. It never wakes up. And for some people, it wakes up for one or so many factors and reasons.
Can you give us some few of those factors?
Well, it could be environment, it could be lifestyle, it could be within lifestyle, you have your diet, you have lack of physical exercise, you've got other health issues that might lead to cancer, in terms of lifestyle, your sexual activities, for example, because there's some sexually transmitted infections, if not treated properly, can actually lead to cancers. For example, the papilloma virus, if it's not treated in women, it can become cervical cancer. So there's so many things. You've got a lot of emphasis is going on environment and diet, but also lifestyle. If you think of our stress levels now, stress is also a really, really big factor and a precipitator, not just for cancer, but so many other health conditions. So I think there's not one factor, but just several factors. But yes, we all have oncogene, but also some cancers are hereditary. Which is basically you're likely to experience it if it's within your family, if it's more pronounced in your family. So, yeah.
So I know, before I come to Nima, let me just ask you one more question. Is there any age limit? Because sometimes you can see younger kids going through cancer and you see older people. I mean, for the kids, I don't think it's primarily lifestyle. For the older people, it's different. So what are the advantages and disadvantages with the age range for someone to actually come across cancer based on the two issues that we've spoken about, either genetics or lifestyle?
There's no advantage and disadvantage. I would say is, did you choose the short straw? In terms of children, there are children cancers. There are cancers that are unique to children that adults don't experience. Likewise, there are cancers that are unique to adults that children don't experience. For example, children don't experience breast cancer because they're not at that formative stage of their life yet. They've not hit puberty and so on and so forth. So when you think of the hormonal related cancers, they will not experience that. Children tend to experience a lot of blood cancers, more than solid tumor cancers. So that's the big difference. Which is why, cancer is unique. Because cancer is the type of disease that really cuts across. It doesn't have any boundaries. It doesn't have boundaries in terms of your age. It doesn't have boundaries in terms of your race. It doesn't have boundaries in terms of your gender. It doesn't have boundaries in terms of your sexuality. It doesn't have boundaries in terms of your socio-economic ability. So you could be rich, you could be poor, you could be homeless, you could be a destitute. you will still have cancer.
Okay.
So that is what makes cancer unique and why we're all united in it, because it affects everyone and anyone of all walks of life and all age.
So the theme is actually making sense now with what you just explained. Interesting. But if you're watching out there, don't forget to join the chat, because Isata is going to get to you guys and possibly read some of your messages and respond to some of those messages on the chat. And let me come to Nima. Whilst you're doing that, we're coming straight to you when we don't talk though with Nima. Because they talk too much English, man. But anyway, not my fault. So I get two Bukuman and I have to. So if I give me talk Buku English, I don't blame you. I don't blame you. I try for switch. I try for switch to the crib when they allow me. Okay, Nima. And I say you experience within the cancer range is well over 15 years, and we get a lot of things that we community shy away from when are the chemotherapy and the few more other treatments they cause alarming deaths within specifically women, because the men's side of it is not so much that we see all the time, but we see a lot of experiences with women when they go through chemo and other kind of treatments. How you advise them for be positive about any of those treatments that they are going through and still become part of the community in a way?
Wow, that is treatments, cancer treatments, all cancer treatments or any treatments for you they take getting side effects.
Yeah.
You understand? So in most of these treatments, they're choosing based on the individual. We're still coming to the uniqueness and are we united in this? So it depends. They will assess you first. And based on your personal or based on the type of cancer that you have, that's when they'll prescribe what treatment they'll go for. And also, they also look at the comorbidities. So we're looking at your levels. If you're already sick, you've got cardiac history or things like that, there are certain chemotherapies that they will not give.
Okay, so it will affect your other illnesses.
Yes, because your other organs are already compromised.
Okay.
So you don't want to make them worse. So having said that, I know the myth about chemotherapy. Most people have had that in their mind that, once they give chemo, you die. No. I want to take that myth away from people then. Chemotherapy is really safe. The reason why we're doing this, once your cancer is detected early, at that time, you're still strong.
Okay.
You're still energetic. The other good cells are able to fight or resist the treatment that you're taking. So the treatment is there to treat the cancer. I don't want people to believe that, once you take chemotherapy, you're going to die. It's that if the doctors have looked at your prognosis, they've looked at the cancer that you have, and they said, yes, this treatment is good for you. I will encourage anybody, don't shy away from your treatment. Once they've made that plan, and from diagnosis, coming back to the Union of International Cancer Control theme this year, the plan is for individual personalized medicine.
Okay.
So it's you that matter. That's why we're doing this. And I just want to go back to Isata. 7 years ago, because you started this, that's why a lot of our people are coming out and people are believing that, yes, there is help out there and there is help. When you go in there, they told you your diagnosis. Remember, go with somebody, ask all the questions. If you're not sure, make notes, go back before you make any decision to say, I'm going to go for that treatment. Make sure you read about the treatment.
So what are some of the basic questions that you might want to ask the doctor?
I will ask, what's my prognosis? What is this? Is this going to be a curative treatment? Is it going to be palliative? Because these treatments are different. Because
so the curative is the one that you might
get better.
Okay.
Yes. And having said that, there are some cancers, T-Boy, that you cannot kill them.
Okay.
They just go in remission. So that means they, as I said, they will just sleep or maybe quiet. Something will trigger them back and will come back.
Okay.
So, but when they say palliative, that is more or less of symptom control. So if find where you go, now that clinically, when they tell you diagnosis, let you know how far you don't reach. What's in your treatment plan? Is this curative? Go for it. That means you get chance. Palliative, sometimes for just control your symptoms. So chemo is not all that bad.
Okay. So what about the male side of treatments? I know saying that the woman side mostly you don't touch on. So you get the male form of cancer we don't see a lot as well within our community, but still subtle, not compared to the way how we get the female cancer illnesses within our community.
As I say earlier on, different cancers they present differently.
Right.
Like for example, most of them solid tumors. Some cancer when they say in situ, then be able for treat them surgically. So then we're able to remove the tumor, remove the cells.
So it's like doing an operation on it.
Yes. Okay. So then we're able to do operation, then go clear the margin. What do I mean by clear the margin? Take the surrounding cells and send them at the lab and make sure say nothing or then good cells and they don't take. So some cancer then they will, as we say, then catch early, you don't need chemo.
Okay.
Sometimes they can just do radiotherapy just for like insurance purpose for say we don't zap that area there for clear the cancer. So with the main one we talk about, it's all the same. Man themselves they get chemotherapy.
Okay.
If the prostate cancer don't reach to certain stage, and also as we can always say, man self they get breast cancer. So if it depends on the kind of cancer, and we talked earlier on about blood cancers, that in different type of blood cancer, and research has improved so much that like different therapies are in place now. Immunotherapy, you have the CAR-T therapy, where they take your own cell and take another lab, try for transform them and give you back for fight against the cancer. So research is evolving, and we hope, say, cancer cure will definitely come, but we're still working.
Now that you mentioned the kind of research that is going on with cancer, before I come to Aheta in group chat where they go on right now, you feel say within our community we did do enough for help, raise awareness, for raise fund, for like we get people really donating to cancer research in the UK or in Sierra Leone or possibly elsewhere?
I haven't said that, T-Boy. If you notice, most of the treatments are based on research done from Caucasian patients.
Right.
So this is
make them understand from
white people. Yes, from we white partners then.
Right.
We black people, we know they go for research. And there is so much research out there. Like, for example, we were talking about leukemias, we were talking about blood cancers, myelomas, and stuff like that. These are things that affect the bone marrow. Black people don't go out there to donate. And we need people to go for donate so that now we own community or people then go for them different research and studies them. And there are different links, different websites where you go. Like, for example, Myeloma UK. Then they cry out for Afro-Caribbean people then for come forward.
Really?
Then they cry out for Afro-Caribbean people to come forward for research. Because let me tell you, myeloma affects 50% to 60% of Black and ethnic minorities. So if we don't go for the research or the studies, we will not get the right treatment. Basically, then when they give you something, like I will talk to one patient, like we own bone density is different from the white people.
Yeah.
We skin we melanin our own skin is different because we skin protected because of the sidewalk come on the sun and everything. That's why if the Caucasian people are exposed to a lot of radiation, they're so easy to get skin cancer.
Right.
Having said that, Black people too can get skin cancer, but it's more on white people.
Okay.
So talking about other cancers, as I said, like some blood cancers, some lymphomas, myeloma, this affects a lot of Black people. And sometimes we miss the symptoms because, like, for example, we have sickle cell in our Afro-Caribbean people. People look at, oh, my bone in the heart, or something like sickle cell again. But no, some of these blood cancers, the symptoms are really get a constant pain. Someday you see don't know more. Someday you for don't small, you don't broke bone. These are all pathological fractures. That's why if you get pain constantly, you need to go and get yourself checked.
I think Sidari biological terms and medical terms. I am with two learned cancer specialists, and I think the knowledge we I pick up today, I don't deal with them people as over the past 15 years. But I think the cancer skills are going to be improving from now on. And I think I've known a little bit about what this whole cancer thing is about. And sometimes I don't give advice, so not take me advice. I am not a specialist to give you any advice whatsoever. But with my small influence, I will direct you to Aikata Sisejalo, I will direct you to Nima, and few more other nurses then, because we get to be group way full of nurses. That group they are not say they exist. And if you did it in a man, you took trouble. Every day they give you medical greetings in the morning. Mami Ice, I know you've been online chatting with your health show partnership guest, and what's on the chat?
Oh, quite interesting actually. I actually got carried away by the chat because it's quite interactive. It's going very well, you know. It's funny. Alimatu Dimonike said, "You're doing well with the Krinish, you know, the Korean and the English. So they pan pata pata, oh Ben and so we're not right. So make us so. But as long as the people that they understand, and hopefully, if we non-Sierra Leonean people themselves watch, which we hope they do, they'll pick it up as well. And what did someone mentioned about prostate cancer and the fact that it's important for this said it's important you go do your checks because sometimes some of these cancers they present without any symptoms. Right. And I responded and said yes, but although that might be the case sometimes and you need to keep an eye on you PSA levels, which is specific enzyme whether they go do blood test and do it's also important for know that sometimes people do also experience symptoms like bleeding, blood in their urine.
You mean men for
men,
prostate?
yeah, blood in their urine and urinary infrequency and so on and so forth. Pain, like Nima is saying, sometimes when prostate cancer is quite in its advanced stage, it can go to the bones.
Okay.
So for some people, they're actually diagnosed through when it's metastasized, which basically means it don't spread. So sometimes some people they like Nima say, now for then go for down, then fracture, then go, then check. They're like, this is a pathological fracture, not just the usual fracture where you go just jump you for you broke your foot. This is because the bone don't eat like where you get sponge where you was do you dishes with. Right. We get a small hole them. So that's how when cancer then a bone now, so they do the bones. So it's easy for a break. And so sometimes through that then we'll diagnose them when they begin go back they realize say this is cancer but it's not from the bone. The origin is somewhere else, and in some cases for prostate cancer, then they would realize that it's from prostate cancer.
Okay.
So that's one of the things. And then Alimatu also asked the question that she made a comment and she said, this has been a real insightful discussion. Thank you, Alima. I'm really proud. Some years ago, through Public Health England, we learned many women and in communities affected by FGM were reluctant to have their smear test, what advice do you give women who have fears around their attachment to harmful traditions? Yeah. As we know, Alimatu is quite an activist when it comes to FGM, one of the flag bearers of that cause. We know it's female genital mutilation, and it comes without a doubt trauma. And so for a lot of women who've gone through, who've undergone FGM, they've had so much trauma, and with that trauma, even though it might be years, they still suffer from what we call PTSD, post-traumatic stress and trauma, you know. And because of that, they don't want anyone to go anywhere near that area. And of course, with smear test, we know it goes through your vagina.
Yeah.
To go into your uterus and do a bit of check, get some cells, and go and check it in the lab. And so for them, it's even smear test is uncomfortable anyway, generally. So let alone for someone who is experiencing that level of trauma. So I think what I would advise people like that is, excuse me.
For drink water.
I can drink tea.
Lots of tea, na ginger tea.
So it's the constant education.
Right.
Constantly reassuring them. I know there's a lot of female and women group that are supporting FGM women for educate them, because it's not just even around doing investigations like smear test or doing things like that. Even their sexual relationship is affected.
Right.
Even their childbirth experience is affected. So there's so many things that this cohort of people suffer from or becomes very much uncomfortable of, that they're unique again. And so they need that extra support. So that's what I would say. And also reiterate the importance why they need that smear test. I think if you counsel people in the right way and use the right approach, it's always easier and better to get your message through. And then someone mentioned what are the common symptoms. I've given them a little bit. There's so much in terms of symptoms, Ishmael. So that list is not exhausted. Someone just mentioned this is well educative, and then someone said keep it up, Sana. And then Alima also said that when Nima was talking about men can also be diagnosed with breast cancer.
Right.
Alima to actually mention that a male friend of hers died recently of breast cancer.
Wow.
And then Maratu said, can you please stress to our men in our communities how important it is to get checked? Life matters, of course. Health is wealth. And I think one of our host here is as guilty as charged. And so he's actually himself made that commitment that he would persevere, he would continue to do what he's supposed to do to make sure he's checked and he goes for his you know, I mean in the UK here, I can't speak, but even in America, because I've got another dear sister, Mabinti Kamasanko, who just said yearly checks. In America, for example, they call it physical. Every year you have to go for your physical. Even the children go for physical before school starts. When the term starts, they go for physical. Here, we look at it from a different perspective. Here, when you have your children between the age of 0 to 5 years, they have their red book, or I don't know what color it is now, and they get that checked through their health visitors and so on. After that, the school also keeps an eye on them and check them through their formative years and so on and so forth, and you as a parent as well. When you become an adult, I think it's important you build that relationship with your general practitioner, who we refer to for short as GP. Go do your checks. Go when you're supposed to go. If you're in doubt, if you're not sure, go. I know people would say, but I went and they turned me back and they said nothing was wrong, and then later something was wrong. Persevere, be persistent, keep going, but also be a good storyteller.
What does that mean?
What that means is, firstly, you have to understand your body, know your body, know the difference between normality and abnormality, and then observe patterns, observe changes, note them down, and then take that information to your GP and tell a story. I'll give a typical example. Okay, let's say for 4 weeks, you've been waking up at night, having to go to the bathroom to pass urine, and then you come back, and then you're having night sweats, and then you're feeling very dry. You wake up, you're thirsty, you drink, but then an hour later, you wake up, you're thirsty. That is not normal.
Yeah.
Keep an eye on that. If it happens just one day, fine. Maybe it's just you've just had a bad day, or you've had too much to drink before you went to bed, and so on and so forth, or didn't, and so on. But if it continues 1 week, 2 weeks, you're building a story. So when you go to your GP, you're saying to your GP, Dr. Tamba,
Not my doctor.
Dr. Tamba, in the last 4 weeks, I noticed a change in how things happen with me in terms of passing urine. And the doctor will probably say, what do you mean? Oh, well, since February or since January, I noticed that every night now, I wake up 2 or 3 times. And prior to this, I was the type of person, once I've used the bathroom before I go to bed, I don't wake up until when it's time to wake up in the morning. But I've noticed that difference. And also now I notice my bedding is wet when I wake up because I've been sweating, and so on and so forth. Tell your story, build a story and tell it. And when you do that, I will bet you 100%, no doctor is going to turn you away. They would start from the basics and say, okay, let's do this, let's do that, let's do that. Let's rule all of that out first. Because one thing I always say to people, a lot of the symptoms that you experience with cancer are also symptoms that are common in various other types of diseases.
Okay.
For example, your diabetes, for example, your heart-related conditions, and so on and so forth. So it doesn't mean because you've got severe headache, that means straight away you've got cancer in your head. No, it might be that you're thirsty. It might be that your eyesight is going. It might be that you need to change the lens. Your vision is affected. It might be that your lighting in your room or in your office is not the right lighting for you. So you're experiencing migraine, intensified headaches. So you might be dehydrated. So there are so many differential diagnoses, is what we call it, that they have to go through first. And then if they make little changes or little adjustments and it's still not improving, then they start going now for bigger tests, you know. So that is all I want to say to people. So those were some of the things that there. So I think, so far, that's what it is. But the key message, a lot of people here are saying, annual checks, do your annual checks, do your screening. For example, Fodesila was talking about your prostate specific antigen, which is your PSA levels for men to check for prostate. For women, mammogram. I already did my mammogram I did my mammogram in November, you know, because once you turn 50 in the UK, you do your mammogram. In the USA, it's younger than that. I think between 45 to 50, you start having your mammogram. You do your smear test, of course. As long as you get to an age where you're sexually active, they encourage you to have your smear test. And what other screening tests?
You got bowel screening.
Your bowel screening.
And the new one that's come out now, you got a lung screening.
Exactly.
So you got the all this mobile clinics or test clinic going round. Please, people, just take this opportunity and make the most of it.
Take it.
Yes,
take it.
I just want to add what Isata said earlier on. When you go to your GP, most of the time when you present with your symptoms, the GP will ask you, what would you want me to do? That's where you need to be assertive and say, this cough has been going on for more than 4 months. Please refer me, I need it checked. That's where you need to tell your story, tell your history. I've got family history of prostate cancer, I've got family history of breast cancer. So those are things that the GP will look at and say, oh, okay, you're complaining of these prostate symptoms, or your mom had breast cancer. There is a connection. If you had a mom that's got breast cancer, you as a man, you're at risk of getting prostate.
Okay.
Yes. So those are the things you need to tell your family history, and you need to be assertive when you go to your GP. And please insist, if it's not right, demand the GP have the right to refer you.
All right. Well, I don't give me about knowledge really make guys not me. It's just the. But anyway, I haven't been going to see William for the past 5 years, which means I do my regular checkup once or twice a year before I leave and when I return. But that doesn't mean I haven't done my checkup for the past 5 years, though. Because the way this man is looking at me, I look like you have a gas slap me in the face. But it's very serious that you do your check. And I clearly understand where these fine ladies are coming from. Because again, as a man, we always shy away from doing those tests and we think, oh, yeah, I'm okay, I'm fine. But I don't know about my condition, but I think I'm fine. Because so far within the past couple of years, I've been okay. And I've done 1 or 2 of my checks and I think I'm okay. But again, God knows whatever happens within our own community, within ourselves as human beings, is always different. We're not going to go anywhere. You're watching Sarah J Media, and we have the health show specialists here today, Mrs. Isata Sisejalo and Nimata Toure Conte, or Nimata Conte Toure. We just stop for beginning use this in our double bag name. This is Isata Jalo, and this is Nimata Toure. Period. In our double name, there is not what we're interested in anymore because you guys are married women. But we can't go to now the Freetown kind of experience of waiting cancer Tanek. And also say Mrs. Isata Jallo don't spend a lot of time in Freetown with the Ward 2 Connect. And now Ward 2 is being officially called the Health Show Partnership Ward, which is what we celebrated before Christmas. And that was our Christmas gift for 2024.
I know.
And now we are into 2025. I did not go to Ward 2 for so many reasons because I did not know my way to Ward 2. Not Ojoko.
And then final. Can you imagine? It just clicked. It just clicked. After all the work, this man went to Sierra Leone. You know why? Because he's afraid of hospital. Not all because of anything. No. They avoid them like how they call themselves. Now I do so. So now see the people them who say I come out now they don't come back. Some people.
By the way.
Some people them.
By the way, I did not go to Ward 2 for specific reason, but I passed that corner to the way how I see the thing at the gate, I'm like, and obviously I have inside this corner hospital. That just diverts. People take me keke. I go. But anyway, what has Freetown been like with the Ward 2 project and some of the major issues that you guys are faced with in terms of managing the ward and managing the cancer patient that we have at Ward 2? I say we because we're all part of Ward 2.
Oh yes, we are all part of it. The we've got so many stakeholders. We've got primary and secondary stakeholders. The donors are stakeholders. Everybody watching here is a stakeholder. And if I look through the people who are watching, I would say at least 80% of them have contributed financially, morally, to the World
And we need more of their money
the
as
World
well.
2 project. And we need more.
More of your money.
More of your money.
More of your money to be
I'm
coming
just
in.
working on the campaign right now because we need to change the windows. We need to change the windows. What are the challenges? It's been, I wouldn't say it's been difficult. Difficult is a strong word. It's been trying, very trying. But I think it's been an experience worth having.
Okay.
You know, I won't lie, I have to be honest. There are times where I think I just need to pack my bag and leave, as in wash my hands off this project. And then what would happen? The next day, somebody will call me out of the blues, I need help. Or do you know that my so and so went to Ward 2, the way they treated them, it was so nice, it was so pleasant, thank you so much. And then I forget whatever challenge I was experiencing. And but it's been amazing, to be honest.
I can sense your specific choosing your words.
Yeah, it's been amazing. No can be better anymore. It's been amazing in the sense, when I say stakeholders, especially the nurses on the unit, the cleaners, the housekeepers, from the inception, they bought into the idea, they bought into the concept, they bought into what we wanted to build in Ward 2. And I think that has been a very, very key element in terms of the success of the
As in connecting the individuals to the ward, it makes them feel like they belong to this. Yes, they are part of it as well.
They are part of it.
Yeah.
So keeping the ward clean, as you know, still we won an award, the cleanest, the best ward. It's even better than the annex. And it's because of the staff there. Not because of me,
okay,
because I'm thousands and thousands of miles away. But it's because of the staff there. They look after that unit. And I think Ward 2 has been quite pivotal in what cancer care looks like in Sierra Leone.
In what way?
In terms of the delivery of care,
okay,
what they deliver. Us as stakeholders can proudly and should proudly say anywhere that it is our project that created the first chemo outpatients in Sierra Leone as part of the Ward 2. I think we should proudly say that, all of us. And since inception, we've supported close to 1,000 patients,
cancer patients,
coming in for treatment as day case. These are not the ones on the beds, because the beds we've got 20 beds, but most times it's 18 that is in use.
Okay.
So these are not the patients that are inpatient. This is just those who come for their treatment once a week or once every 3 weeks, and so on and so forth.
Are those treated being supported by the health show or family members or just free will donors all over the place?
Some of them, in terms of their funding, their treatment, some of them are self-funding.
Okay.
Some of them is through family, and some of them is through other charities, through the health show, and some of them is the health show that will fund them.
So what has the taboo been like in terms of the awareness that the health show has created within cancer in Sierra Leone, specifically for Ward 2, as one of the pivotal points of what cancer is?
In terms of promoting cancer in Sierra Leone, I will not take credit for it, because you've got two key charity non-governmental organizations that are doing a lot of work, and they've been doing a lot of work even before my time, at least 10, 12, 20 odd years. And that's Thinking Pink, Breast Cancer Foundation, and then Well Woman MEPS Trust. They've really led on, for some of us, we've just joined, as we say, united, because together we can make bigger and greater impact.
Right.
So they really started, and that is what inspired some of us to say, actually, if these people can do it or they're trying, let's join them and make it better. So, but Ward 2 has been unique. Unique in the sense, yes, a lot of health promotion was going on. Yes, a lot of outpatient clinics were going on, but there was no proper unit to support cancer patients. You know, Of course, when we started, we thought, oh, okay, this is a female surgical ward. It was just going to be about breast cancer patients and so on.
Right.
And then, of course, the chemo unit, which caters for both men and women. And then with the unit itself, it's not just now just surgical, it's also medical. And it's not just breast cancer. It could be gynecological cancers. It could be gastrointestinal cancers like bowel cancer. It could be urinary related cancers like bladder cancers and so on. So everything and anything that could go on that ward goes onto Ward 2.
Wow.
Yeah. So that is really that has been really pivotal and positive. The other thing is as well, I think during the time when we started the campaign, which was, I think, 2019, 2020, the current First Lady, Her Excellency Fatima Madabio, also through the MAC Foundation, supported quite a few clinicians to be sent abroad to go and study and learn about cancer.
Okay.
So in the last year or so, those clinicians have started coming back.
Okay.
So that in itself, again, is making a difference, because up until recently, we only had 1 or 2 or so. But we're getting more now. We're getting pathologists, we're getting clinical oncologists. So we're building up slowly and slowly. So in terms of what cancer looks like in Sierra Leone, we're still a long way, but it's work in progress.
Okay.
You know, there's chemotherapy available for sale, not in every pharmacy, but in some pharmacies. Again, part of our fundraising this year is going to be about buying fundraising to buy a biotech cabinet, which is a special unit where they can mix the drug. So there's more to be done, but we've come a long way, and I think we need to tap all ourselves on our shoulders and say kudos. We've done
mine.
Yeah, we've done very well. All of you out there, we've done very well. So I think we just need to continue to build on this and then just get more people on board. It's not just my project.
Okay.
It's all our projects.
Let me come to Nima on that. I know, Nima, you've been back and forth in Sierra Leone since the health show was introduced at Ward 2. And your experience in Sierra Leone with cancer patients, is it the same? Because we're not talking about Sierra Leone specifically, because we know there has been a great kind of taboo and myth about Nami stepmama kill me, Nami stepmama they witch me, Nami uncle not like me. A lot of myth has been going around. Is it the same kind of myth that is still existing in Sierra Leone in your experience as you're going back and forth over the past couple of years?
Wow. Not much per se, because I think, as Isaac clearly said, there's quite a lot of work going on in Sierra Leone now, like especially in Freetown. I know it's not more in the provinces,
right?
But there is so much awareness about, like, I've seen in social media, or I've got like a few nurses, like when it comes to certain cancer awareness months, like January gone was cervical cancer awareness month. Cancer people, what was the clinic called again? The Well Women Clinic.
Well Women Clinic, yeah.
They did a live program, like reaching out to the people, raising awareness about signs and symptoms, what to look for. And there are free screening programs I've noticed most recently that they're sending out. So we're getting there. However, the myths are still around. They're still there. People are still reluctant to go out when they have certain signs and symptoms. They'll just think that, oh, let me go to a village, let them go smoke me, or let them go pull out medicine, I go up and they go better. And me saying that, even here in the UK, I will not, I'm not to look down on we Black people. It's not just Sierra Leoneans, it's across the board of Afro-Caribbean people. I had a patient that present with a tiny lump on his nose. And he literally, after being told his diagnosis, he pulled me out and said, me pikin, that in their dialect, that I'm going to go home and have this sorted from a traditional point of view. And I was like, this is quite in situ. They can do just a little excision and clear the margin, you'll get better. But because of the myth about the treatments of cancers and what have you, and I believe it's still happening in Freetown, because I've had one or two people saying that, oh, me not go for that chemotherapy there, oh, I know they go under, when you go to the hospital, they will go tell you, say, you get sick what you don't get. And no, the doctors, they no wish for tell you, say you get certain sick, what you don't get. So me telling that little story, few years later, this gentleman came back, it spread. Instead of having a little excision, he ended up with a total rhinectomy, like having the whole nose removed.
Wow.
You understand? So these are things, that's why we're doing these programs, to just encourage people to know that these doctors are educated, the treatments have been trialed and tested, so low enough afraid say, oh, this is me, stepmama. I don't believe in that anyway. It doesn't work for me. But however, some people believe in it.
Yeah. Okay.
So please, not go to hospital. When them free test, then come. But me going to Freetown, talking about World 2, congratulations to all the World 2 staff. And I want to take this moment to remember the special nurse who was there at the beginning, who we sadly lost because she was a pivotal person in that department. I remember when I went to present, the way she was so happy. You can see the joy. She appreciates what in the health show partnership is doing. And Ward 2 staff, you guys are excellent and you're doing a very good job to maintain the ward. And kudos to the health show. Ward, please, partners, let's continue to donate to the health show partnership, because the work is ongoing and it needs a lot of funding to sustain it. I think
that funding is going to come this year because we're going to find the money. And when I say we're going to find the money, we're going to task certain individuals within our community that are supposed to be stakeholders to do their corporate social responsibility. Because it's very important. They're doing it elsewhere. They should be doing it in our community as well, especially when it comes to issues like this. I'm going to throw some challenge at the health show. I'm going to throw some challenge at the health show. Not partnership, but the health show. I know we've been talking a lot about Freetown, cancer, Ward 2. Are we going to spread our wings to the provincial towns? I know you guys came from specific towns in Sierra Leone. I'm not talking about Freetown to be specific. I know where you're from is the north, where you're from is the southeast, and I am from the southeast as well. And many other people who are supporting the health show are from various different regions in Sierra Leone. We're not talking about the myth that we have within our communities. We're making reference specifically to Freetown, but you just highlighted the fact that when issues like that struck in Freetown, they go to the provinces.
That's right.
And the provinces don't have any of this kind of cultural awareness of what cancer is all about.
Yeah.
Is the health show going to start to spread their wings to the provincial towns?
Well, surprise, surprise. The health show already spreads her wings across the provincial towns. In Kenema, the Kenema District Hospital actually has a little surgical unit there where sometimes women present, especially women with breast cancer, advanced stages, fungating. So there's a doctor there who trained in Russia, who we've actually had on one of the programs, and he went back to Sierra Leone in 2021. And so he has been deployed. He's in Kenema. So he tends to link in with me, and then we converse. I give advice, support, whether it's also people where there's a good prognosis, support them with funding for their treatment as well. And then sometimes if it's surgery, they can do it in Kenema, but if it's not surgery and it's chemo, they have to go to Freetown. So they're sent to Freetown. Of course, when you're sent to Freetown from the provinces, it's not just about your treatment, isn't it? It's about your accommodation, your food, and we know nutrition plays a very, very important role with the treatment of cancer,
right,
and how you respond to treatment and your improvement as a whole. So yes, so there is really, really, really opportunities there. There's the intention. It's just waiting for the right time and the right moment. But yeah.
All right, well, I'm going to throw this at the Health Show Partnership Program.
Again.
No, not the Health Show Partnership Program, but the collaborators that you have within the Health Show Partnership Program.
Yeah.
People who are making contributions towards the program, people who have made significant contributions, people who have donated their money. I mean, some of these people came from very different parts in Sierra Leone. So I think it's about time for the Health Show to start introducing these people about the idea of saying we can set up a unit in some of these major provincial hospitals that will start the possibly awareness first, because if you don't create the awareness, then you not get the people to come. I mean, should we embark on an awareness campaign in the various provincial towns for this particular year? Some outreach so that people can be aware of what is happening within cancer and try to reduce the myth?
We should, but I think before we do that, we need to do a bit of a scoping exercise. What I really like is my next visit is not just focus on the health show ward. I'm getting used to calling it the health show ward.
It is what it is.
In Freetown, but actually go and visit key areas. For example, go to McKinney and visit the hospital in McKinney. I would like to go to Kono and visit the hospital in Kono. I know Kono, to some extent, have benefited a lot from Partners in Health. So I don't think they have too much of a worry at the moment. They're very much lucky to that extent.
Kabbalah,
And Kabbalah as well. Yeah. They've also got Partners in Health there. But it's really the key places I think that needs a little bit more of attention is probably the main city of McKinney, and then Bow and Kenema, because those have district general hospitals.
Okay.
And if you can invest in those district general hospitals, then it makes it easier. Then you outreach into the PCMs, the community hospitals, and so on and so forth within the various suburbs or villages and so on. But that's quite a big project. But I think the key thing I would like to do first is scoping.
That's right.
Go to those key 3 different hospitals and find out what they have in terms of resources, in terms of knowledge, in terms of the space, in terms of the environment, and then we take it from there. I mean, a lot of people don't know, but actually the health show wanted to start in Kenema because that's my hometown. But for one reason or another, we ended up in Connaught Hospital, Freetown. But again, it wasn't a bad idea as well.
Well, I know it's not a bad idea. It would have been beneficial for the people living in Kenema, but again, Kenema is not Sierra Leone. There are other places that also need that sort of support.
Yeah, but also I think the reason why I opted for Freetown is because, as I said at that time, in terms of oncology professionals, it was very limited, and they were based in Freetown. So it's better to start where you have the clinicians, rather than would have gone and set up a whole unit in Kenema. But if you don't have the clinicians, it makes it different. Yeah.
All right, that's fine. We're about to wrap up, but before we wrap up, I'll go to Nima, and possibly I know for sure you have done a lot within our community. But let me just remind people that they're watching Sarah J Media live on YouTube and Facebook, and you're watching the health show, which I am in control of today. Yeah, it's me in charge. The health show has been something that we've all paid attention to, and we've all worked very hard towards it. And to where it is right now is a lot of celebration for the people who have followed the health show, who have participated, the guests, the donors, and the partners. It's got a huge network of Sierra Leoneans that are connected to it, with the brain sitting down next to me. And I know you are also one of the brains behind the health show. And for you, you are the quiet one sitting from the outside, looking at what is happening, and you're feeling, wow, that's good. We've done this, we've done that. So what would be your take and advice to some of the people watching in terms of everything that we've talked about for World Cancer Day today, that we are actually celebrating in terms of creating more awareness, which is be united by unique. Over to you.
Okay. To be united by unique. So you, our viewers this evening, what I want you to take away from this program today: know your body, know what is not normal, because that is the main drive for World Cancer Day, is for us to reach as many as possible out there to understand the signs and symptoms. Early detection save life. So please know your body. We will not say this. We will say it every day, anytime. Know what is not right. If it's not right, get it checked. That's what I want to leave with you today. Please, health is wealth. Thank you for watching.
All right, thank you very much, Auntie Nima, as I normally usually call you. And the reason why I am calling her Auntie Nima, because she's a respectable woman and she's always sitting nicely in a corner minding her business. Well, today you haven't minded your business. I've dragged you into minding my business. But it's a privilege to have you, and it's very much interesting to have you two in the studio. And I will now go to Madam Aisata. No, I saw you for the buttons you say before the Jalo. I'm now going to Madam Aisata Siti Jalo. What will be your roundup message? And I know today is World Cancer Day, as we all sitting here talking about it. And I know you've got a lot to say, and you've done a lot over the past couple of years. When you talk in 2000, I remember say 2000 is just not too long ago, but guess what? It's 25 years ago.
It's 25
years ago, and I remember when the millennium came, we were celebrating it. Now, 25 years ago.
25 years ago.
Share your experience and your message for the World Cancer Day today.
Well, for me, to my people out there, today is call for action. Call for action to remind you all that cancer is real, and it has no boundaries, and early detection saves lives. But also it's a call for action to our leaders in our African countries to pay more attention to cancer, because it's killing a lot of our people, and sometimes it's not really necessary. And we need to invest more in treatment, resources, infrastructure, human capital, to make sure our people are being looked after, because a healthy nation makes a wealthy nation. So I think that's important. For my people in the diaspora, we're lucky to be in the diaspora where no matter how much we feel healthcare is not at the level as we expect it to be, it is far better than for our people in our continent of Africa. So I would really challenge you to make use of the opportunities you have here and the resources, but also to my cancer survivors or those who are going through treatment or those who might just be going through their diagnosis. I want you to know that your experience is unique. Your feelings, your emotions are unique. To your families, your loved ones, and friends around you, we feel for all of you. And we want you to also know that the way you feel is unique. Everybody's story is unique and everybody's experience is unique. But please reach out and don't suffer in silence. Don't worry about what people say about you. I know there is an element of privacy and confidentiality that is required. And I know we all have different ways of coping when we're faced with such challenges, but always make sure you find that one person to speak to. My sister Nima has mentioned it. When you're going to the doctor, go with a friend, a family member, somebody you trust who can take down information for you, because it can be very overwhelming. The journey is not an easy journey. It is full of challenges, but also a lot of successes, because medical science is evolving and there's lots of modern treatment that is now available with less side effects. So please don't suffer in silence. And I just want to say thank you so much. And it is World Cancer Day. Let's make a difference. Let's make some noise. It's not going to end today. We will continue having this discussion. And if you found today very useful and beneficial, then save the date in your diary, Saturday, the 17th of May, for a live Line and Dine show that you can come to for a reasonable amount of fee. For ladies, it's cheaper than a pair of shoes. For men, of course, it's cheaper than a pair of trousers. So just a little fee so that we can come and talk, learn, and share, not just about cancer, but other health issues that we're facing in our community. So thank you so much, Sarah Jamidia, for hosting us. Thank you.
It's a pleasure to have you too. But just to reiterate Isata's last message, for women, it's cheaper than having a new boyfriend. You're not going to spend too much. For men, it's also cheaper than having a new girl. You don't have to take her to dinner and spend hundreds of pounds. No. So just come on that day and you will learn and share. Thank you very much for watching. And you're watching Sarah J Media Live from YouTube and Facebook. And you're watching myself and the operators behind the cameras of the Sarah J Media team in the UK. And I want to say thank you to these fine young ladies. And if you put their two age together, it's a millennium. But anyway. But anyway, it's a pleasure to have them in the studio. And this is the very first time we're hosting YouTube. Yeah. And it's a privilege to host the health show for the first, well, not the first time. Yes, officially for the first time. I've been a co-host on various occasions. Yeah. And Juma has been a host. And I am hosting for the very first time. And Nima has been a host as well. Of course, this is the host of the health show. Yeah. So basically, it's a pleasure for me to be here and host the health show on the World Cancer Day, and we'll bring you learn, and we'll bring you united by unique. So don't forget to do your checkup. Don't forget to go to the hospital and make sure that you're fine and safe for another decades to come and more decades to come. So from myself and the Health Show Partnership team and the people who are behind the scene and the studio operators and the Sarah J Media team, We'll have a comeback, and that comeback will be happening anytime soon. So don't go away. Continue to follow us, like our page, and share our programs on YouTube and Facebook for another edition. Maybe next week. Who knows? I wink my eye to that and say goodbye and have a pleasant evening until we meet again for another edition of the Health Show, which is going to be hosted by Mrs. Isata Sisejalo in the forthcoming week, next week, I don't know, but she will tell you guys when she's ready to do that. Have a good evening and keep it safe. Goodbye.